Hello, everyone. Welcome to day 2 of our virtual workshops on health information exchange standards. My name is Linda Bird, and I'm the instructor for the Health Information Exchange Standards course here at UVic. Just before we get started, we acknowledge and respect the Lekwungen peoples on whose traditional territory the university stands, and the Songhees, Esquimalt and Wasanich people whose historical relationships with the land continue to this day. Now, this workshop that we're delivering today is part of our Certificate in Health Terminology Standards program. And in particular, this is the third course of that program, HIMP 537, on the Health Information Exchange Standards. So if you're interested in joining the program and achieving a certificate in health terminology standards, there's still time to apply for the next intake that starts in September. So if you're interested, please visit the UVic Health Information Science Certificates page and submit your application by June the 1st. So we had a wonderful workshop yesterday, and so I'm looking forward to day 2 today. We're in the middle of the overall program, and today's focus is on Canada Health Infoway standards and the Pan-Canadian Interoperability Roadmap, which we heard a bit about yesterday, but we're really looking forward to hearing more about that today. And then following the workshop, the graduate students will stay online and will do some hands-on activities related to data terminology, mapping, and other good stuff like that. So here's today's lineup. We have not one, but 4 wonderful guest speakers from Canada Health Infoway. And the first 2 of those are Janice Spence and Julie Boutin, who are both Snowman CT subject matter experts at Infoway. I love that. And yesterday we heard about CHI Standards 101. And today, Janice and Julie will be presenting together on Infoway Standards 101, including who Infoway is, what services they offer, how to get involved, and what's on the horizon. So thank you very much, Janice and Julie. Over to you. I'll stop sharing. And Janice, you can pick that
Linda.
up.
Yes.
You're welcome.
Round 2, here I go again. Just give me a thumbs up if you're seeing my screen, okay?
You're okay, Janice.
Okay, wonderful. Thank you, everyone, and we're very happy to be here to give you an overview of Canada Health Infoway, and in particular, the Digital Health Interoperability Standards team. Just a bit of introduction. As mentioned, as Linda mentioned, I'm a standards specialist working with the National Release Centre here at Canada Health Infoway. And the National Release Centre is essentially the core department that manages the terminology standards such as the SNOMED CTCA edition for Infoway. I have been in the health information management business for roughly 21 years. Of those years, I've had experience working in acute care hospitals, particularly in, started off in coding and abstracting, then moving on into health information analysis. And then after that, my career took me to the provincial digital health layer, where I worked with Ontario, working on several large-scale provincial projects for developing terminology standards for such repositories like the Clinical Data Repository and the Diagnostic Imaging Common Services Repository for Ontario. I've worked in the Health Information Exchange Standards space now for roughly 9 years, 9 of those 20 years in the health information realm. And my newest experience is now at the federal level, working with Canada Health Infoway, with particular focus on SNOMED CT. So I'm very happy to be here to talk about the world that we love, which is standards, and more specifically terminology standards. And with that, I hand off to Julie to introduce herself.
Okay, so quickly, same as Janice, I'm a standard specialist at Canada Health Infoway. more particular for SNOMED City. I have a diploma in health informatics from the University of Sherbrooke. I completed several courses in SNOMED City. The latest one is the SNOMED City Authoring Level 2, and I did the certification. I have experience in healthcare and government, particularly in lab, in LIS integration, implementing standards in support of health information systems, and I'm also involved in translation process for SNOMED City content.
Great, thank you. So our agenda today is to go over, as Linda mentioned, who we are as an organization, what services we offer, going a little bit deeper into health terminology and data exchange standards, which is our core business for our division, touching a bit on applying interoperability standards, looking at what we have on the horizon, and finally, how you can get involved if you so wish. So about Infoway and the interoperability standards team. Infoway was established in 2001, and we were established as an independent nonprofit organization accountable to the 14 deputy health ministers for all levels, including federal, provincial, and territorial governments, with a mandate to create an electronic health record for all Canadians. Our mandate specifically covers leadership and oversight in accelerating national digital health initiatives while fostering a vision, strategy, and overarching architecture on a pan-Canadian scale, ensuring that there are national standards safeguarding privacy and security while doing so. So what is our vision and our mission to achieve our mandate? At Infoway, we want to ensure that all Canadians have equitable access to excellent healthcare and health information. We believe that a more connected and collaborative system is a healthier system. Our mission is to inspire, inform, and mobilize Canada's healthcare stakeholders towards a shared and reimagined future where digital health helps create a better and more connected experience with the patient at its heart. By integrating digital health into the healthcare experience, we unlock more efficient and accessible models of care. We facilitate faster, more seamless, and secure information sharing. And most of all, we can help enable better health outcomes for all Canadians. We're committed to improving the health of Canadians by accelerating the development, adoption, and effective use of digital health solutions. We do this by connecting, convening, and galvanizing stakeholders to work towards a health system that provides better, more connected experience, and again, with the patient always at the focus. This gives an overview of where CHI is currently focused, and apologies, in the presentation you might hear us interchangeably refer to ourselves as CHI or Infoway. We're the same thing. First of all, I'd like to go over our major national initiative in e-prescribing adoption, which is called Prescribeit. Many of you might have heard about it. This is an e-prescribing service that provides safer and more effective medication management that has been rolled out at a national level. Of course, our main goal is to achieve digital health interoperability, which we will actually go into a little bit more later on. And that is to ensure that the main levers to help achieve interoperability, laying the foundation in Canada for health data exchange and health data exchange architectures, application interfaces, and standards that enable data to be accessed and shared appropriately. And of course, these standards that enable interoperability are really where our bread and butter is as a digital health standards team. Partners and stakeholders. So as with everything, particularly in interoperability, we can't go it alone. We have several partners and collaborators, entities and organizations at different levels to achieve these goals. Government entities at the federal level, such as Health Canada, for example, provinces and territories just working with jurisdictions like Ontario to create provincial registries and repositories like the Diagnostic Imaging Common Services on the Ontario Lab Information System. Also, healthcare organizations such as hospitals who would like to apply standards at their facilities. Industry partners to help foster use of standards-based solutions and tooling, such as rolling out standards-based EMR solutions for clinicians or hospital information systems. Clinicians that provide clinical requirements, expertise, and more importantly, to help act as champions for standards and standards leveraging. And of course, patient engagement is crucial to understand what's important to them as the key client as we collaborate to develop standards-based solutions for healthcare delivery. What are Infoway's goals? Mainly to see that there is a better connected health system across Canada, easier sharing and use of health information so that Canadians can expect a higher performing world-class system. As we all know, Canada's health system is facing unprecedented strain, and these challenges demand an extraordinary response to keep Canadians healthy. Harnessing data sharing will result in connected care and a more modern and responsive health system. We also want to ensure that there is fostering of trust, that the health information is handled safely and securely, and also ensuring that there is support for Canadian digital health innovation. Sorry, I just wanted to see if there is a question here. Okay. So here we're looking at an overview by numbers of some of the benefits realization of Infoway's digital health investments to date. There's an estimated amount of about $43 billion in benefits recorded since 2001, mainly in connected health information, enhancements to EMRs in the areas of telehealth and virtual care programs overall. To date, we've seen almost 100,000 Canadians accessing telehealth services. And more crucially, in our rapid response to COVID-19, we had also well over 100,000 providers who came on board adopting virtual care tooling and over 5 million virtual visits by Canadians. In order to support the national standards portfolio, we currently have the staffing as depicted here. We have a director that runs the Interoperability Standards Division and 3 managers with key areas of responsibility, SNOMED CT, which is where Julie and I fall, as well as standards operation. That's everything else that the National Release Center would be responsible for. And then we have more specifically a fire and technical interoperability stream. And supporting those managers are 6 standards specialists, again, broken down by domain and expertise, SNOMED CT, LOINC, PCLOCD, as well as HL7 Fire as the emerging standard that supports many of the specifications that are being rolled out now. We also have 2 part-time translation experts that support particularly translation of SNOMED CT concepts as required, as well as 2 clinical experts that we have available to us as part of that content development process. And with that, I'm going to hand it over to Julie to talk about the standard services we provide.
Thank you, Janice. So here are the standard services that we provide at Infoway. So the goal of the NRC, the National Release Center, is to be a one-stop shop for stakeholders. So this is the central point to find the necessary information regarding the standards used in digital health interoperability, whether for terminology standards, such as SNOMED CT, PCLOCD, or LOINC, for messaging standards such as HL7 Fire, or for standards with a broader scope, such as IHE, DICOM, or ISO. Next slide, Janice. So Infoway has different ways to provide direct services to Canadians for these standards. For standards content development, Infoway is the National Release Center for clinical vocabulary, such as Knowledge-CT and PCLOCD in Canada. Also for licensing and distribution, Infoway is an affiliate license holder for both HL7 Canada and IHE Canada. We also provide secretarial support to the ISO TC215 community in partnership with the Standards Council of Canada. Infoway is the voting member for Canada on international DICOM ballots. We are a member of DICOM Working Group 6 to help inform Canadian requirements to the base DICOM standards. Next slide. So to achieve these responsibilities, it requires the use of different tooling. As an example, for content development, we use Inform for request submission and management. We also use TermSpace, which is an authoring tool that we use for authoring Knowledge-CT new and existing content, as well as for translation. And we also use dashboards to track content issues for different topics or projects. Next slide. Infoway provides convenient access to a wide range of licensed and proprietary material via another tool, the Terminology Gateway. So this is a web-based solution that enables the distribution and sharing of terminology concepts, subsets, and concept maps, making them available for web browsing, download, or real-time query. So all Knowledge-CT, LOINC, and Infoway software tools are available at no cost to users with an active Infoway account. It is possible for users to subscribe and receive notifications to be aware of any new publications on the Terminology Gateway. Important note here is that to ensure compliance with our various agreements, Infoway account users are asked to reconfirm acceptance of these agreements by March 31st of each year. Next slide. So Infoway also provides various services for the communities of practice. For education and training, for example, we can provide training on the use of Informs, for example, or on the use of other tools by organizing demonstrations. These demos may be available, as well as many other relevant information, through the monthly webinars of the different groups or communities. Different collaboration groups and community of practice are also accessible to everyone to discuss common topics. We'll talk about that more in the next slide. Infoway provides various information regarding current or upcoming projects, as well as any other topical information that may be of interest to the community through different communication promotion channels, such as our monthly e-newsletter, Dispatch, which Janice will tell you about later, but also via social media, such as Twitter and LinkedIn. Next one.
Oh, delay in the system. Okay, here we go.
There are different ways for community to stay in touch and learn, and InfoCentral is an excellent collaboration hub for this purpose. Communities provide an opportunity for people to collaborate and communicate on interoperability topics that are of interest to them and also for their peers on an ongoing basis. They foster open, inclusive participation and encourage diverse perspectives. Communities provide a space where you can share news, attend education sessions, connect with experts, host meetings, share lessons learned, and find both new and historical documentation that could be relevant to your needs. So there are different types of communities. They can be domain specific, such as medication management or enterprise imaging. They also can focus on a specific interoperability priority, such as secure clinical messaging or secure patient summaries. They may focus on particular standards, such as HL7 FHIR or SNOMED City, or they may be formed by a professional group, such as community of nurses or physicians. People actively contributing to interoperability solutions will drive the need and demand for these communities. There are also working groups made of committed implementers and engaged stakeholders with broad representation. They will be led by project sponsors, leads, and/or facilitators. The output of these groups will have a direct impact to on-the-ground success of interoperability projects, either immediately or at a point in the future. Examples of working groups are FHIR implementations, sex and gender, organisms, French translation, patient summaries, social determinants of health. Working groups can be formed in response to needs identified by the Clinical Interoperability Steering Committee. They can also be formed to support the goals of a community. We also have the Standards Center, where you will find a lot of information about standards. For example, if you go to the PCLOCD Lung page, you will find various information about the standards, as well as links to the latest releases for download, how to participate in communities, implementation guidelines and resources, content change, and more. So next slide, please. Okay, here are some links if you have any interest to learn more on one or many of these standards. These sources are complementary to what you can already find on Info Central. SNOMED International offers a wide variety of online courses, tutorials, and learning pathways that help to extend your knowledge and understanding of SNOMED City. Reconstruct Institute brings you to the Lung Library, where you can find a free quick start guide, a video of introduction to Lung, a step-by-step primer for getting acquainted with Lung, and more. HL7 International, where a wide diversity of course is provided. Infoway ongoing webinars will give you a complete list of upcoming webinars from the different communities. Likewise, links to different organizations that also provide courses or training on standards. Next slide, please. So here are some metrics for the 2022-2023 year of Canadian interoperability. So we have more than 4,800 updates to international clinical vocabularies, more than 40 projects that are available and accessible in the Canadian FHIR registry, more than 140 different standards releases, and more than 2,100 various standards related engagements, most of them through inquiries sent to help desk. Various operational activities performed by Infoway standards team are required in order to be able to produce these metrics, such as the update of the Canadian editorial guidelines for SNOMED City, so in English and in French, the update of Info Central standards page, the management of requests for change via Inform for SNOMED City, PCLOCD, SCP type, SCP qual, HL7, and subset. We also have to achieve the biannual publication of SNOMED City, so both the international publication and the Canadian edition. We also have the biannual publication of PCLOCD, the maintenance and update of subsets, the management of HL7 ballots, and we also provide support to jurisdiction and publication of their terminology artifacts. Next slide, please. So we have more now on health terminology standards. As we said earlier, Infoway is the Canadian National Release Center for PC/LOCD. The Pan-Canadian Lung Observation Code Database is a Canadian constraint of the larger lung terminology. Releases contain codes that are specific to use in Canada, including example of Pan-Canadian names for jurisdictional lab viewers, both in English and Canadian French, and recommended units of measure, UCOM, for use in Canada. We do not have a Pan-Canadian constraint of clinical lung codes. PC/LOCD only includes laboratory codes. If a clinical code request is received, we forward it directly to Regenstrief Institute, which is the organization who maintains lung. As seen previously, PC/LOCD is released biannually at the end of March and September. Next slide, please. Next slide, Janice. Oh, did we lose Janice?
Hi, sorry about that. Yes, you certainly did lose me. I'm sorry about that. Let's try that again. Just let me know if my screen sharing has restarted,
Yes.
please.
Perfect.
Okay, great.
Perfect.
Okay.
So for the metrics, lung has now over almost 100,000 terms. And in the latest release of PC/LOCD, which was in March 2023, it has now over 38,000 terms available in English and in French. Okay, next slide, please. Okay, Infoway is also the Canadian National Release Center for SNOMED-CT. SNOMED-CT is the most comprehensive multilingual clinical healthcare terminology in the world. As for PC/LOCD, the Canadian edition is available in US English and Canadian French, and is released biannually at the end of March and September. The Canadian release of March 2023 includes all the February international edition of SNOMED-CT, plus for 4,527 active Canadian concepts and more than 145,000 French translated concepts. More metrics on the next slide. So more metrics on the Canadian edition of SNOMED-CT. Notably, nearly 900 new concepts were created only for this last release, as well as 9 new subsets, for a total now of 50 subsets that we maintain every year. We receive 1,835 requests for translation on a total of a little bit more than 2,900 requests. So we added more than 65,000 new translated concepts for this release. We are still involved in the creation of new concepts related to COVID-19. So 8 new concepts have been created as well as translated for this latest edition. Next slide. So what are the uses for standards? So the relevancy and importance of healthcare terminology depend on the user's goals. Different healthcare terminology standards fulfill distinct purposes, and each generally does a good job meeting its purpose. In other words, when users match their purpose with the correct standard, they generally find the correct terminology. Next slide. Well, standards are used in part for data capture or entry and integration. Health standards used in Canada provide the clinical terminology and system communication that enable the thousands of healthcare providers across the country to communicate and share health information in a consistent, unambiguous, safe, and reliable manner. Next slide. Another reason to use standards is to share information. So when using digital health solutions, these standards can support safe and secure exchange of healthcare information across the continuum of care, clinical decision support with alerts and reminders, synoptic reporting, for example, for cancer care management, population health management, for example, the screening and the public health, for data analytics, and for performance management and research. Next slide. So for sharing information, data exchange, or messaging standards are necessary. FHIR is the latest standard developed by HL7 and stands for Fast Healthcare Interoperability Resources. It is comprised of logical building blocks called resources that are assembled to create solutions that solve real-world clinical infrastructure and administrative issues. So back to Janice for the final part.
Thank you, Julie. And I apologize in advance if my connection is a bit spotty. Hopefully I don't lose the screen again. So we're going to go now a bit into the application of these standards that that Julie has just illustrated, and where are some of the areas that we see these standards being crucial to, in particular, to interoperability. So where do standards fit into interoperability? Effective delivery of care, of course, requires interoperability, which is the seamless flow of information between different solutions and devices. There are two key areas of interoperability, and that's really the technical connection and then the data shared that's facilitated through that connection. So there are 4 levels overall to achieve the overarching goal of interoperability. As depicted on the screen, the baseline is foundational, or what's sometimes called the technical layer of interoperability. And this is where we see the interconnectedness happening there, the requirements for one system or application to speak to another. This is where the sort of nuts and bolts are put in place to ensure that that connection can happen. At level 2, or structural interoperability, or sometimes called syntactic interoperability, this is where the data is defined in terms of format, syntax, and organization to ensure exchange, including at the data level field for interpretation. And at this layer, we see some examples of where standards come into play, particularly data exchange standards, such as HL7 V2, HL7 FHIR, DICOM for imaging, as well as HIE profiles. The next layer, level 3, or semantic interoperability, provides a common underlying models and codification of data, including the use of data elements with standardized definitions from publicly available value sets and coding vocabularies, providing shared understanding and meaning to the user. And it's really at this level that I'd like to see where we use that common phraseology of where the rubber hits the road. At this level of interoperability is really where there's that exchange of not just information, but of meaningful and actionable data. And these 2 layers, the realization of these 2 layers really need standards applied for those to be achieved. At the organizational, or level 4 layer of interoperability, This is where the framework is put in place to ensure that it's sustained, including governance, policy, social, legal, and organizational considerations to facilitate the secure, seamless, and timely communication and use of the data, both within, between, and among organizations, entities, and individuals. These components enable shared consent, trust, and integrated end-user processes and workflows. Let's take a closer look at why interoperability matters, particularly in a landscape of disparate and heterogeneous systems. It enables communication and common understanding across the health system. So let's imagine, for example, as I'm sure we've all encountered, where a family physician wants to communicate with a specialist in another practice, but of course, leveraging two different EMR solutions. While some solutions offer secure messaging capabilities, most cannot communicate or share data with other systems. Instead of collaborating directly, clinicians have to develop workaround like the trusted fax methodology, where it increases physician burden, calls for duplicate documentation, gaps in patient health information, untimely access of records, duplication of testing, which of course results in costly delays to patient care, which can ultimately impact health outcomes. More connected health systems using standardized data for common representation equals interoperability. And interoperability in action equals improved continuity of care, collaboration between providers, patients having access to their own health information, making them more stronger advocates for their own health, enables sharing of more meaningful and actionable data through, again, very important standardized data content. Also, it equals breaking down of data silos by ensuring integration and connection is possible for seamless data sharing, and thereby reduces inefficiencies and redundancies within the health system. And that again allows for information to be collected once and used for many purposes when we apply interoperability standards. There are certain characteristics used to gain insight into the level of maturity and adoptability of standards and their implementation specifications. Here is an example of a standards implementation maturity model using the SNOMED-CT maturity framework, which conveys a standard or implementation's maturity based on its implementation state. The adoption level conveys a standard's approximate or average adoption level for a specific digital health solution. So in looking at this SNOMED-CT framework, we'll see each level provides for increased value from the use of SNOMED-CT. It can be used to assess the current maturity level of a SNOMED-CT implementation or to help plan for high maturity levels, which provides additional benefits. Here we can see level 1 and 2 brings value to helping standardize data through mapping to SNOMED-CT or using simple code systems. But really, it's only when an organization implements SNOMED-CT at a level 3 or above that the true benefits of SNOMED-CT can be fully realized, such as enriching clinical data and for use in decision support systems, which enable precision medicine. So we've looked at the standards implementation and adoption maturity model. Now let's go one level deeper and look at the standards process maturity levels. This conveys a standard or implementation specifications maturity in terms of its actual stage of development within a particular approval or voting process. And here I've chosen to illustrate the standards maturity model, which is HL7's latest standard and still evolving standard. And it has evolved through 4 releases since its initial emergence in 2012, where it started from a draft standard for trial use at a level 1 and is now currently at its first non-trial for use release 4 or R4 level. And in the R4 level, you see, like, for example, 2 key clinical resources for patient and observation were actually released as normative. A normative really means that the resource level has been approved by ANSI, which is the approving standards body. And looking ahead to FHIR R5 or Release 5, we will see even more normative content with over 30 resources having been nominated by HL7 working groups to be mature to that status. Infoway is involved in standards development work and help to influence the evolution of these standards through the community collaboration that Julie mentioned before and through the HL7 balloting process. And I'd just like to emphasize that this process is really crucial in ensuring that standards evolution meets the needs of the community, of the stakeholders, and it's not happening in isolation. So as a standards development organization, we try to ensure that all stakeholders from the Canadian perspective are actually helping to influence that through through involvement in the HL7 working groups. So where has this journey to achieve interoperability taken us over these past 22 years? We've had co-investments with jurisdictions in setting up foundational electronic health record systems, such as laboratory systems, patient portals, and electronic medical records, EHRs or electronic health records, that have laid a foundation for Canadian interoperability. We've seen increased use of digital health tools, which has created renewed impetus to address key interoperability challenges, to enable better coordination and continuity of care, facilitating better communication and collaboration between patients and providers, with a view to improving better health outcomes for all Canadians. Standards are now more a part of the solution instead of the once perceived barrier. I remember entering the standards space about 9-10 years ago, and you know, for many projects or initiatives, the standards representatives coming into their room usually resulted in a bit of a pushback, hesitation as to, you know, are we going to be proven to be barriers to agility, to fast tracking a standard solution. And we have seen where, as we've become more knowledgeable about the benefits of standards, that has changed. We still have a ways to go, but I think we've made significant advances both to the systems as well as to the attitudes to leveraging interoperability standards and understanding the benefits that it can realize. So now I'm just going to take you down just a little bit of an overview of some of the main projects that we've implemented or are working on. And I'll start with Prescribeit, as I briefly mentioned before. Prescribeit is a national not-for-profit e-prescribing service that provides safe and more effective medication management. And it's widely implemented, more than 300 communities live. Well over 3,000 pharmacy sites have enrolled, and more than 4,000 prescribers enrolled, and that number is going up year over year. It is a HL7 FHIR-based specification in terms of the base standard that it relies on, and it leverages standards such as HL7, UCOM, PCLOCD, as well as SNOMED CTCA for the data content. Next is the Canadian Clinical Drug Dataset, which some of you might be familiar with. And the CCDD, as we call it, is a national drug interchange terminology. And just a note about, you know, an interchange terminology versus an interface terminology. An interchange terminology is one that is primarily designed to be used inside systems to support the sharing and meaning when the systems communicate with each other, as opposed to an interchange where it's used to provide mappings, for example, the use of a SNOMED CT or a LOINC. And the interface terminology's purpose is to support clinicians' entry of patient-related information into systems and to facilitate display representation of computer-stored information. So the interchange terminology that the CCDD provides will allow pharmacy systems to continue using their existing drug terminology, but leverage CCDD to just exchange that terminology. And for example, if the national product number NPM, a proprietary terminology used by, say, First Data Bank or Cerna Multum, they don't need to actually change their local nomenclature, but facilitate the data set to do the exchange within systems. The knowledge-based vendors, like First Data Bank, will include a mapping between their proprietary codes and the CCDD in their products, enabling that interoperability of the medicinal product names and descriptions. I won't go into details. We've provided a link where you can get more information, but it includes data such as the manufactured product or the non-proprietary therapeutic product, the therapeutic moiety, and the device non-proprietary therapeutic product device. So it covers quite a few tables in that national drug terminology. So next, I'll touch a bit on the patient summary pan-Canadian specifications. Attila is going to talk more about patient summaries in the interoperability landscape today. So this is just a quick touch point on the specification. The PSCA, as we call it, is based on the HL7 FHIR IPS specification. And it's the patient summary is really a health record extract. It's not intended to be an exhaustive health record, but more a point-in-time snapshot that's specialty agnostic, comprising of a standardized collection of clinical and contextual data to inform a patient's treatment at the point of care. It's to facilitate the sharing of these patient summaries across different solutions, and it has been identified as a priority based on extensive consultation. So the version 1 of the specification, which was released in 2022, includes data categories such as allergies and intolerance, problem lists, immunization, history of procedures, medication summary, vital signs, past history of illness, and social history. So as proof of concepts are tested and more jurisdictional use cases are defined, of course, additional data categories may be added in future releases. And FHIR profiles will continue to go through rounds of iteration and refinement as testing events take place, and also based on jurisdictional and vendor priorities. So we expect that these standards will evolve. So it's part of a collaborative development process underway that facilitated the development of the PSCA for trial implementation in 2022. So it's, sorry, advance. So in terms of a data content model, the specification is configurable to address jurisdictional needs. So it's really a reference implementation guide that allows you to adopt for your implementation needs where needed, where applicable. It allows for different standards to support jurisdictions, such as defining a data content model, leveraging data, content, and terminology standards that are fit for purpose. So for example, you'll have different layers of terminology bindings allowed. You can have HL7 FHIR defined value sets, for example, an administrative gender code set. You can have pan-Canadian subsets as required for your jurisdiction, as well as having jurisdictional codes and others where required for a particular implementation. And again, this is just a snapshot pointing time map of implementations of the projects that I've mentioned before, like Prescribeit and Patient Summary, but it's not a representation of all the implementations of other nationally recognized standards such as SNOMED-CT and LOINC, PCLOCD LOINC, sorry. We do support a lot of initiatives to leverage and develop those standards. For example, we work with Can Immunize, which is the body that maintains the Canadian Vaccine Catalog, to create a lot of SNOMED-CT content for the national immunization terminology. Of course, as Julie mentioned, we do a lot of work with for COVID-19 concepts, as well as working on major projects with CIHI for developing minimum data sets as part of their modernization projects for For example, the Health and Human Resources data set and the organ and donation transplantation programs. We also, as mentioned before, do a lot of content development for provinces like the OLIS system in Ontario. We do work with the Mental Health and Addictions Dataset iGuide and provincial provider registers as well for the Ontario province. Do a lot of work for Quebec and Quebec projects such as health and security at work, lab information system, death bulletin, etc. We support at the EMR level as well, for example, creating cardiology concepts for MD, modernization of sex and sexual orientation content, the GSSO working group. As Julie mentioned, we do have working groups, and that's one of the bodies that's dealing with this work. And though we support SNOMED CT, I can speak to the lab LOINC and clinical LOINC. Our NRC team does do a lot of work with, for example, with OLIS to ensure that lab LOINC content and PCLOC content is developed according to their needs. And we also create a lot of clinical LOINC document ontology. We handle a lot of requests for the clinical data repository in Ontario. So there's a depth and breadth of many projects that we have to support to ensure that content for these terminology standards are meeting our stakeholder needs. And I'll just show you just a little bit of a snapshot of a major project that we have going on with CIHI, who they might have mentioned it as part of their delivery, as part of the organ donation and transplantation performance reporting system modernization. We're working to develop the ODT data standards that includes many standards, one of which is SNOMED CT. And here we've shown that we've created concepts for both the deceased donor and the transplantation and living donor minimum data sets as part of this collaborative initiative. So quickly, what's on the horizon? I know Abby will be talking a little bit more about what's on the roadmap for interoperability later on. So this is just to say that we know that that to go forward, there needs to be good governance models and strong partnerships to be successful. And that's part of what we are looking forward to as an interoperability enabler and advocate. And our view is to continue to support the use cases and minimum data sets for projects, as we've mentioned, to maintain the focus on a few key areas to ensure that we help to solve those use cases that are of national importance, with a view of rolling out larger interoperability roadmaps in the future. So finally, how to get involved. As you can see, we have quite a few projects going on, and we do facilitate a lot of standards-based initiatives, collaborations, discussions, working groups. One of the key areas that you can look to stay in touch is subscribing to our digital health dispatch, where we provide a lot of information about, what are some of the new releases that have come out for standards, what we have on the horizon, what are some of the key initiatives. So we do encourage you to subscribe if you like. And ending just with a few key links, if you'd like to know more or get involved, InfoCentral is a key area that you can go and see what's happening in the standards space, and to sign up for working groups and communities, and the Terminology Gateway, of course, where you can go and browse subsets to see what we have for offering. And the health terminologist community, which I'm sure is is of keen interest to this group, you can certainly sign up to keep abreast and to contribute to what's going on, to keep abreast of initiatives or to influence and contribute to standards development in Canada. And with that, I know we don't have a lot of time, but just want to end off with any questions that the group might have for us.